So here we'll talk about cancer registration. Under the secondary prevention for cancer, we have cancer registration, early detection and treatment. So these are the three things which are covered under secondary prevention of cancer. So let us see about this cancer registration. It is a sine qua non of any cancer control program. What is sine qua non? It is a first essential step in any cancer control program. Once we know how many cases are coming and what type of cancer is most common, we can control it effectively, right? So it acts as a base to assess magnitude of the problem and also helps us plan this better services. Once we know how big of the problem it is, we can plan better services. So it acts as a base to assess magnitude of the problem and also helps us plan a better services for this cancer. Under cancer registration, there is a collection of uniform minimum set of data which is recommended by WHO handbook. So this WHO handbook has some set of questions which are needed to be asked under this cancer registration, right? So these questions are given by WHO handbook. For hospital based registries include inpatient and the outpatient details. Of course, in the hospital they will be having details about inpatient and the patients leaving the hospital, right? These registrations basically includes inpatient and the outpatient details. So advantages, it helps in evaluation of the diagnosis and also treatment programs. So we can apply this knowledge clinically to effectively treat the people. Coming to the disadvantage, it is not used in epidemiological purpose because it is not covering many number of people. It is only covering the people who are coming to their hospitals, right? So it is not used for epidemiological purposes. Let us see the population based registrations. It aims to cover complete cancer situation in the geographical area. So it is covering large set of population. So this population based registrations are covering complete cancer situation in a particular geographical area. Optimum size is 2 to 7 million of people for this registration, and the advantages are we can find out the incidence rates and also it is helpful in epidemiological studies because we are conducting this on such a huge population like 7 million people. We can use this data in epidemiological studies, and also it helps in evaluation of the plan, operation, treatments. So by this we can evaluate the plan to effectively control this cancer, right, activities in the main areas. Coming to the disadvantage, it has a limited application in the clinical case. We cannot use this knowledge to apply clinically. We cannot use this knowledge to treat the patient. And also too much of the information, too large population should be covered. There can be delay in the reporting and also there can lead to incomplete follow-up, right? So these are the different disadvantages. So first thing, coming to the disadvantages, here we have to cover too much of the population. It can be a disadvantage, and for too much of the population we have too much of the information which can be incomplete, and delayed reporting can also seen. And the main disadvantage is it cannot be applied in clinically. We cannot use this knowledge to treat patients. So this is the disadvantage. And if we talk about this point, a right step is to first set up this hospital-based cancer registration and then extend the same to population-based cancer registry. First thing what they are trying to say is first set up this hospital-based registration and then extend it to the population-based cancer registry for the effective cancer control program. So this is about cancer registration. Bye.